Thank you, first of all, for joining us today on this lovely Sunday where we are celebrating Raksha Bandhan in India. And we are especially excited to have all of you here today because this is our fourth session on the Widen platform by a prominent woman speaker. And today's topic, of course, is unique. This is our first non clinical topic, but something that is so imperative to all your clinical skills and to all your clinical endeavors. So, this is really the foundation or the stepping stone to being better practitioners, better clinicians. And as we wait for more people to join in, let me invite Dr. Shilpa she's already with us. So, Dr. Shilpa, if we can have you on stage with us.
Hi, can you see me?
Hi, yes.
Yeah.
Good morning.
Good morning. Good afternoon, everyone.
Yeah. It's very, very early where you are right now. So thanks for getting up and ready so early.
That's fine. Thank you for having me on this wonderful platform. It's a little bit early at my end, but still, it's all worth it. Thank you.
Yeah, I see you and Dr. Manish always like start off your lives and your days really, really early. Sometimes it's 4 in the morning or 6 in the morning. I don't know how you'll do it.
No, that's not me. That's not me. That's Manish. He's a morning bird. I'm a night owl.
That's great. So today we've pulled you out of your Sunday morning sleep. So sorry about that, but I'm sure everyone's waiting with full excitement to kind of learn what you are going to offer us today on the topic of communication. So
yes, thank you.
Before I actually invite you to speak, I'd love to introduce you to all of the guests gathered here today. In fact, I think most of them were present on our live as well. But for those of you who missed out on Dr. Shilpa's introduction at our live session, let me give you a quick recap. Dr. Shilpa Chitnis is a practitioner in the UK. And of course, she hails from India itself and has migrated many years ago and now runs 5 successful practices with her husband, Dr. Manish Chitnis, in the UK. What I find really unique about Dr. Shilpa's CV is that besides being a clinician par excellence, she has mastered the field of communication and patient experience. So, where I see her talk to people as a mindset coach as well as somebody who's uniquely dedicated herself to the field of dentistry and helping dentists to actually bring out the best in their personality through effective communication. She believes that dentistry is a people focused profession in which good communication skills are essential to assess and accurately address a patient's complaint. I couldn't agree more. And as I have myself experienced her firsthand coaching session for improving my mindset and communication, and I really advise all of you should try and experience that session. The interesting thing about her work is this ability to coach dentists, and all her coaches say that now they understand that through coaching, you have to trouble the comfortable and comfort the trouble. And with this, she has been effectively and efficiently changing and contributing to our profession to make us better dentists every day. And that's why she's here with us today, doing exactly that, talking on the pearls of communication. So we want the session today to be extremely interactive because it's on communication. So we'd like you to start posting questions even between the session. Today we're doing it slightly differently where we won't wait for questions after the session. Feel free to raise your hand or put it in the chat box and we will address the questions as we go along. Dr. Shilpa, welcome.
Thank you.
Once again, yes. So the stage is completely yours now. You can take it away.
Right. So as we spoke last time, communication is a topic which is very close to my heart, mainly because in our field of dentistry, we often concentrate more on clinical topics. And Though we understand the importance of communication in each aspect of dentistry, we never actually hone our skills into the area. I came upon this topic by chance because I wanted to improve myself, mainly in the commercial sense of being able to talk to my patients properly so that they take the treatments easier from me. However, I noticed that as I embarked on the journey, it helped me not only understand my patients and my team, but it drew attention more inwards. And that helped me focus on my strengths as well as identify my weaknesses. And as I started to work on myself, it helped my team as well. And that is where I find that this is a topic which is extremely important, but often gets neglected. So, hopefully, today I'll be able to share with you the pearls that I have gathered along the way. As Diksha said, if there are any questions, I think that will make it more better if we can get the questions and answer them as we go along. So, also before I start, I'm not a very techno savvy person. So, in case there is any hitch with the technical aspect, please bear with me.
Don't worry, Doc. That's absolutely fine. And in fact, we have a little over 20 participants who've just signed in. And for all those of you who missed Dr. Shilpa's introduction, the topic for today is pearls of communication. And as we go along each pearl, please post your questions.
So, dentist is someone who needs to communicate very effectively, not just with the patient, but with the team, with the lab, as well as the dental colleagues, either working in the same practice or working outside. Now, this communication can be verbal or non-verbal. Non-verbal, as in terms of body language, eye contact, just the general demeanor. When we are communicating, when we're talking to someone, now, not just clinically, even outside the clinic, it is extremely important to be aware that everyone has their own bias or has their own way of looking at things. Now, it doesn't mean there is a right or a wrong always. It's just one's way of looking at things. Now, a very classic example of this is actually two dentists looking at a radiograph. How many times do we, though we've come from the same background, we've learned the same techniques, often the way we design a treatment plan based on looking at that X-ray varies. And we get trapped into saying, oh, my way of doing it is the right way. Now, once I become open to understanding that, yes, my way is one way, but there are 10 other ways of doing the same thing or looking at the same picture. And keeping this in mind makes us a little bit more open to taking in different solutions, different ways of looking at the same thing, as well as it makes us a little bit more patient in handling possible, I would say, rage situations. So this picture actually depicts really well. I am not sure if I've started sharing the screen. I think Diksha.
Sorry, we can't see your screen at the moment. So just share screen, and we'll be able to.
Are you able to see it now?
Not yet. Just try and yeah, we can now. Absolutely. Perfect. Thank you.
Perfect. So as I was talking about perspective, different ways of looking at the same thing. This slide has struck with me quite deeply because often It is where we stand influences how we are interpreting a certain situation. My nurse who comes into the surgery with the view of cleaning up and making sure everything is tidy, her way of looking at things are biased by her conditioning. And I want it a certain way. And until we are on the same page, until we are looking at the picture from the same angle, we're not going to be able to look at the same things. How many times does it happen that you've asked a team member to do a certain thing for you? Maybe you've asked your nurse to set up for a certain procedure. But if it is a newbie, then you often end up seeing that you have to repeat again and again what is it that you need. And that is where, as a dentist, because we are in a rush, we want to get things done correctly, we often get impatient that, how many times do I have to tell you the same thing? But it is about understanding that we both might not be looking at the same thing from the same side of the story. So, in this aspect, mentioning what you need clearly and explaining how you want things to be done plays an important role. How many of you can actually visualize this happening quite a few times and it's someone else's fault? It's very easy to get trapped into the blame game. Does this make sense? Diksha, I would like you to kind of
Yes,
probably
of
keep
course.
yourself unmute because it will help me understand whether I'm clearly able to pass
Definitely.
across my message.
Definitely. I'll
Yeah.
I'll navigate that for you. And on the topic of perspective, something was occurring to me, and this is something that I've been asked before, is that in a lot of settings and like your own, like when you manage multiple practices, staff handling is always like you mentioned, it's hard to keep telling them what to do, and somewhere you still fail in that, like in something or the other still gets missed, right? So how do you communicate with staff? Is it a written format? Is it something that you do as a weekly or a monthly meeting? Or how do you communicate your expectations to staff and make sure that they are giving you the same result across places and people?
So someone very properly had said that systems need to be installed in place. Yeah. So a system could fail, but a person doesn't fail. So we take away the element of blaming someone for doing something wrong.
Right.
So a system is important. For a system to be set, it is important to first know yourself. What is it that you're trying to get out of a particular situation? What is the end result you're looking for?
Right.
Getting that clarity for yourself and then being able to clearly communicate it to the other person. Give them what I want, what are my expectations, so that we are looking at this particular task from the same side of the story.
Got it. And this is
Second,
best done like verbally, or like, by training or email, or like how do you actually communicate this expectation?
so it's always important to first understand what the other person needs. So for
Right.
some people, verbal mention of what needs to be done is good enough.
Hmm.
For some people, they need to know what needs to be done, along with it, how it needs to be done.
Correct.
But for quite a few of them, often just what and how is not sufficient. They need to know the reason why you want them to do it. Because
Correct.
everything is going on well. Most of the times, we dentists, we go on a course, we learn a few new things, we come back to the practice and we want to implement it the next day. Now, we are
Absolutely
fresh with the knowledge, but the other people or the team hasn't got a clue of what we are talking about.
true.
And because we want to implement everything properly, we are in a rush to get everything the same day. And people who are like team members who've been with us for a long time, they know, oh yes, it's probably something new that doctor has learned. It probably will fizzle out. There are two reasons why it fizzles out. One, we ourselves get really tired of telling the same thing, or expecting them to do what we want, or we lose out the consistency. But when I learn something new, if I have mentioned to my nurse, this is what I have learned, this is what I want to try and implement, I might not be able to do all 10 steps the first day, but at least I want to try. And being
Right.
open with yourself, I think that helps create that first, or overcome that first hurdle. Then explaining, if we see resistance, that someone's not ready to comply with what is expected, find out what is making them uncomfortable, because we assume that this person is not ready to work, this person is lazy, or this person has got no interest in doing what I'm intending to do. There could be multiple other factors from their perspective. They might be either scared of doing something new, they might be scared of failing, they
Right.
might be actually not sure why this is needed. Everything is going on well. Why do you have to change things? And these could be people who like to have a routine. So,
Definitely.
understanding, taking all these different angles to the same situation helps us become more open, or almost become a bit more patient in what we are going to probably start as a new way of doing things. Make
Right.
sense?
Absolutely. In fact, I'd like the audience to participate here and tell us, which end of the perspective do you belong to? Are you a young dentist? Are you in practice? Are you somebody working as an associate dentist? So just put down in the chat box whether you are a clinician, someone who owns a practice, or someone who's an associate dentist, so that your point of view or your perspective can be discussed better here,
True.
right?
So,
We may even have some students here who want to communicate better with their HODs, deans, get better in communication during exams, or even with their colleagues. So it'll be nice if we can get a sense of who all are here today.
true.
Right,
So,
great.
perspective, understanding perspective often gives us patience to understanding, and this triggers our innate ability for empathy. Empathy is the most important part for any dentist or any healthcare profession. So, empathy is not sympathy. Empathy is to be able to identify with the other person's situations or feelings. I understand what you're going through, and that in itself creates an ability for the patient to be able to share with you what problems they're facing. Or for that matter, a team member who's feeling worried of doing something. Often we dentists are very technical. We are concentrated on doing things, on doing a certain procedure right. And in that, we we might end up overlooking the part, or the important part about one's feelings, because we are dealing with with a person at the end of the day. And feelings are extremely important, because once we are able to make sure that we understand the patient, not just in what they want us to do, but also in how they're feeling, the connection is much more deeper. And often it is just the gestures that we use that we can help patient feel comfortable and relaxed. And a lot of us do it just subconsciously. It comes natural. but quite a lot of us struggle because we just want to get the patient out of the pain and be over and done with it. When a patient who's extremely nervous comes in and I rush into doing a particular treatment, I often end up just, yes, getting the patient out of pain, which is most important, but I fail often to check how that person is feeling as a result of the treatment. And I've noticed that the more we do this, more sometimes it almost seems like you're mollycoddling them too much. But in our profession, when a patient is in extreme pain, we realize that pain brings out the worst kind of reactions in a person. So, being empathetic is extremely crucial part of being a good dentist. And we are taught to do a filling properly. We are taught to do a particular technique properly. But often this part of empathy is neglected because it is assumed that we all have it or we all express it. Sometimes, especially in our fast paced world, it is extremely important to show, to verbally demonstrate that we understand or we are empathetic with the patient. And the more we practice, the more we learn. So, yes, we learn at times from our own mistakes, but for newbies who are joining, sometimes they could get overwhelmed, um, especially in handling either an aggressive patient or an extremely nervous patient. And what has helped me has been just about giving them time, giving my patients a time to feel that, yes, I am here, I'm caring for you, and I'm going to make sure I do everything to make you feel comfortable. Sometimes a simple thing of reminding people to breathe when they are in chair helps them relax. How many times are we conscious of our own breathing when we are dealing with an unpleasant situation? So it is an empathy with the patients, with the team, but also with yourself. So just be a bit gentle on yourself so that we allow ourselves to not do our best in moments when we are stressed. Especially during COVID times, I've realized this, that we could be the gentlest person for other people in front of us, but we often are quite harsh with ourselves. Make sense?
That's a very good point, because I think we've all been through some very harsh demands on our practices as well as our careers. And I mean, the last 1.5 years has been quite unforgiving in that sense. So the only respite that we had, going from full-fledged practice to actually taking breaks when required, to actually being resilient to the situation, the only quality that would help us at that point would have been to be empathetic even with ourselves. But it's very easy to forget that or not apply that. We can be very understanding to our patients, but it's hard to do it on our own. So we have the chat box going, absolutely very, very interactive and participative. So I'm going to read out a few things as we asked everybody what is their perspective and what kind of journey are they in terms of their clinical life. Dr. Kusum owns a practice. Dr. Ruksar is a young dentist. Dr. Sana Pirboy is a working dentist having her own practice. Dr. Shazia is an associate dentist. Dr. Sanita is a clinician, and Dr. Pragya owns a practice. Dr. Reshma owns a practice. So we have a good mix of people who are working as well as people who own a practice. So they understand that both ends of the perspective are important. There is a really interesting question from Pooja, who says, what's the best way to communicate with our senior dentists to be able to do the treatments we want? Because I think as an associate dentist, the communication with your senior dentist is an important aspect as well. Like you mentioned, the same patient, two different treatment plans could actually lead to quite a conflict there. And I see a lot of young dentists very scared to express themselves in front of their employers or senior dentists. So, how do you deal with that kind of communication? How do you come to the same perspective?
I think quite a lot of times it is about uh, when one is a junior in a practice, we assume that whatever I say is probably not going to be taken into account, or often we are scared of our own limitations. It is, I feel, important to be absolutely honest and open when you're sharing with your colleague that this is what I would like to do. These are my skill sets. How can you? So now this comes to the junior dentist as well, as to, yes, these are some particular skills that you want to demonstrate, but have you done some training for it? Have you tried to, probably the easier thing which comes to my mind is when we were training for doing the international exams here, though we were trained dentists in India, we had to go through all the exams. And for that, we had to demonstrate on mannequins.
Right.
And though I was practicing quite a lot of things which which are not absolutely done theoretically right, I could gain a good perspective of my own strengths by doing things on extracted teeth. Now, when we start practicing, when we have done practice for say 5-6 years, we feel we know everything.
Right.
And practicing on a extracted tooth is almost going back to student days. I don't need to do it. But I feel that has helped me tremendously. So what the way me and my junior dentist, we've always done is when we go on courses, we want to implement things, we have a very clear understanding of what our limitations are and how I would like to improve. When you're open and you share your limitations with your boss or your senior colleague in the practice, without any assumption that you're going to be put off, most of the times it can lead to a win-win situation.
Right.
Now there could be times when you don't get what you want, but rather than assuming or rather than getting frustrated, it is important to be able to mention it, say it in a way, in a non-conflicting, non-confrontational way. I think that helps create an open communication between both the fronts. Right. Because as much as you want to explore newer options, the senior dentist might be a little bit doubtful. Oh, are you going to be capable enough of doing it? And unless you talk and share about it, there's going to be a lot of assumptions. And assumptions lead to a lot of misunderstandings. So rather than assuming, it's better to talk, but the communication can be in a more gentle and open way. Make sense?
Absolutely. In fact, something that I follow in my practice, in fact, as a senior dentist in the practice, sometimes when you see enthusiasm or communication coming from the junior dentist, it's actually very heartening. And in fact, it gives you, ideas to allow the person to grow and innovate in their journey. So sometimes I just tell my associate dentists that when they're not comfortable communicating with me face to face, they might be hesitant on certain things, at least send a WhatsApp, and just test the waters there and see how things can be. So, but like you said, it's really important to communicate your perspective, because as a practicing clinician, be it your own practice or you being an associate, it's important to at least, put your opinion out there in a non-conflicting manner.
True. And on the same note, I would say that all the senior dentists also need to remember that we were once a junior dentist. We have got where we have because of the opportunities we had.
Yes.
And if we don't pass on similar or probably more opportunities to the junior, the teamwork doesn't get to the level where it's a win-win for everyone.
True.
Yeah.
There is a question from Dr. Sanita, if I can take it right now, where she says that here she's talking about the patient and dentist perspective, like how they can be two different things, where sometimes there are patients who don't understand the seriousness of their tooth condition as it's not paining, or they are able to they're able to overcome their discomfort by taking painkillers or something like that. But how do we communicate with such patients and make them understand that even though it may not hurt, but the tooth is definitely, treating the tooth is definitely imperative?
Again, here it is about explaining to the patient what you can see clinically. You can give them or explain it to them with means of pictures, with the means of their x-ray, and make them understand why that particular treatment is needed. But beyond that, you can't do anything to physically get them to do things.
Right.
You know, at the end of the day, everyone has to take their own initiative to handle their own problems. And we dentists get too emotionally involved in that decision-making process. If I honestly give the patient all the options, I explain it to them why a particular thing is needed, and then I ask them as to what is it that stops them from going ahead. It often helps. Now, this is something which Manish teaches on the DBM platform as a means of his ethical selling module. But it is extremely important to understand if a patient is saying no to a particular treatment, what is it that he's actually saying no to? Have you tried to explore that? We get too hell-bent on the patient accepting the treatment suggested, so much so that we forget what that patient might be expecting from us. And yes, at the end of the day, there is a limitation to what you can do and how you can get them to do what you want, what is correct for them. But everyone has to take their own responsibility. And we dentists, we feel that we are the ones to make that decision for them. Because I think patriarchal way of dealing with the treatments is what we've always looked in our society. And I think, yes, sometimes you just have to take a step back so that the patient then feels comfortable to take that step forward.
Right.
Often you will realize that, in fact, there are quite a lot of patients who, the more we insist on a particular treatment, they back off more and more.
True.
And then it is just a tango and no one's getting anywhere.
Correct.
Yeah.
So Dr. Sanita says she gets your point and she'll try to know what is stopping them. And she also said, like, a lot of patients are already very well versed today with treatment. So they're not really waiting for our explanation. But instead, they kind of have already made up their mind what they want to do. So even with effective communication, we can only take them that far. So yeah, point noted that finding out what's a little beneath the surface might really help.
I would like to add one more thing. Often we make a lot of assumptions. And based on those assumptions, we then give our choices or options. What has helped me has always been asking the patient what is it that they want from me. And then it's almost like there's a clarity.
Yeah.
Yeah. So along with the empathy, the perspectives, the moment we become aware of what our strengths are, it helps the way we talk. Because often we are aware of the others, but not so much about ourselves. Now, this awareness is not just the physical awareness, it is more the emotional awareness. The emotional awareness gives us the ability to be able to understand what's going in my head to affect the way I I am or the way I do things? How are others' emotions affecting me? Like when I go to the practice, say Monday morning, my nurse is extremely agitated and irritated. She's not saying much, but I can sense a discomfort in the room. And I can hear a little bit of banging. And I have already started noticing that she's probably stressed. She's probably a bit irritated. And without me being aware of how I am going to react, I react to it. Oh, not again. Not one of those Monday mornings again. The minute I become aware, now the next step is how I deal with it. But the first thing is becoming aware that how her emotions are getting to me, or how my patient who's in the chair, who's got really agitated, who's a bit nervous, how are their emotions affecting me? We Awareness is something which we think we are aware of, but often we are not aware of how the others are impacting us. And often all this emotional outburst, it affects the situation. So I say being aware of the SOS is extremely important. Emotions of ourself, emotions of others, and the emotional outcome of a particular situation. This is what makes us aware of how we do things, how we make decisions, how we react. And often, in that moment of reaction, we often say things that we don't want to, or we do things in a way which are not the way we would have wanted to. So, emotions lead to reactions, but often reactions might be positive or negative. So instead of reacting and then reflecting, if I take a moment to become aware of my emotions and then I do whatever I do, it is a response more than a reaction. And this response rather than reaction leads to a win-win situation. Because in a moment of reaction, we are often working from high strung emotions, and that might make the other person feel really cornered, or can lead to, again, almost like a domino effect. Yeah. Now, I'm sure a lot of us, when we put our mind to it, can become aware or remember things that we've done in a haste, have done things in the heat of the moment. And this awareness actually is an important tool for us to become mindful. There is a lot of talk these days about mindfulness and how it helps, but actually implementing it in action is the most difficult thing. And I would suggest start implementing the awareness or mindfulness and see what a different person we end up being. It is just about becoming emotionally intelligent. Make sense?
Absolutely. I think, in fact, it's really hard to implement this in the hustle bustle of everyday dentistry. We enter the practice and we're shooting off orders to people, and we sometimes don't even see that what state or condition that person is in. Like, be it our team member or be it a patient who's walked in, we tend to dictate the treatment to them without realizing that, are they really scared? Have they been to two dentists before? So this awareness, I think, will take us a long way if we can actually understand where the person is coming from, be more situationally and spatially aware, and then give them our solutions and suggestions, making us much more effective leaders.
Absolutely.
Right.
So for me, it is still work in progress. There are days when um, some things which I think are natural are not natural. Like taking a moment for myself and taking a moment to just see what I would want that particular situation to end in.
Right.
Uh, it is about sitting still. And that sitting still and reflecting is quite hard.
Correct. In
That
our
has
line of work.
been, yeah. Yeah, go on.
Yeah, sorry. I have a question, a couple of similar questions from one doctor. Uh, Specifically, I think in India, there's a problem with convincing patients to come in and do treatments other than pain. Like the general culture for a lot of practices has been to do emergency care and care only when there's pain. So they've been asking how to convince a patient to do treatment in the absence of pain, similar to our question earlier, because this constant resistance to why should I get a treatment done if there's no pain, is there even a problem? So, how do we communicate that better?
I think it is about creating that vision for everyone in the practice so that you all are singing from the same hymn sheet. Whenever you're talking to a patient, keep on mentioning about how you're driven by preventive dentistry rather than treatment only dentistry.
Time. You don't have
Right.
to log in at
It is one of those things where it takes time. It is one of those things where it is almost like you're trying to change the culture of the patients coming into your practice. It takes time, but consistent efforts focus towards the same particular thing. If you're mentioning the same thing over and over again, if you are demonstrating that that is what you believe in, you are going to attract the patients or the kind of people around you who believe in the same ethos. It is just about patience. And I understand that there are a lot of business implications to it. And it is also about how you thrive in the competition around you. But the more you are consistent, people can see it. The more you are genuine, people can see that. And it just has to be a consistent patient effort. I think that's what worked for us. Like when it's not just in the UK, even when we were back home working, managing our own practices. Yes, you do get a mix of people who are least bothered about their oral hygiene, are they just in pain, and on the other hand, they want to avoid any major cost of treatment.
Correct.
So it is kind of being able to talk to what the patient wants. Again, it is about expectation.
True. I think very often people in India do assume that a dental visit is expensive. And that's the underlying fear that they are acting from, which is why they end up assuming that or reacting in a way that pain is their only trigger to get the treatment done. So I think what you mentioned earlier about ensuring that besides even the verbal communication, there are a lot of non-verbal signs that can also be put up in your practice where you can actually ensure that the patient understands when they come in that this is a practice that's holistic, this is a practice that's dealing with pain prevention more than just pain alleviation when it happens. I think a lot of things are said even before we open our mouth. So at that point, people start understanding that this is a different place and that we end up communicating the fact that it's not just just this pain. If other people are coming in to deal with other things, could be a picture of some other patient who's done a full mouth treatment or a bleaching or something preventive like sealants, then that would give the message loud and clear to all the other patients also. So I think it's a combination, but of course, like you rightly mentioned, it's a lifelong journey to start getting patients to think like that. So I think Dr. Joseph, if you could start working on these kind of techniques, and of course you can't waste your time beyond the point on people who don't want to change that philosophy. Our job is to do what best we can for the people who do want to.
Absolutely.
Right.
Yeah, and again, it draws my attention to assumptions. We assume that a patient is not going to listen
Yes.
to what we want them to do. Yeah, so it is becoming more and more aware and mindful of what is it that we expect of ourselves, what is it that the team expects of us,
Correct.
and what is it that the patients expect from us. Without making it a big deal about you, how can it be turned into a strength? Because often when there is a lot of expectations from others, we can feel a bit bogged down, a bit overwhelmed with so many other things to do. If this is added on top of it, then it can be quite overwhelming or stressful. But the bang opposite of being stressful is being mindful. And I think that works brilliantly as soon as the awareness had goes on. Yeah. So for us to be able to connect with our patients, with our team, sharing rapport is extremely important. Now, awareness leads to being able to connect. And connection, a genuine interest, is what triggers rapport. A lot of dentists naturally do connect with patients, but we don't often recognize that this is our strength. We just assume that, yes, this is one of the things which is done. But quite a lot of us who are technically oriented, who are action oriented, who just want to get on with things to do, often struggle to establish this rapport. Now, rapport building can be it's not just superficial, it can go beneath that, where the patient feels connected to you as a person, not just as a dentist. And that is what then leads to the trust. Because for anyone to say yes to any treatment, trust is the big thing. And we all know it. There are patients who walk into the practice and are like, you tell me what needs to be done and we'll get it done. But for that, we forget that we've put in a lot of hard work in the past to feel connected to that person. Now, that connection could be because that person you knew because of your parents, maybe you lived in the same society, or could be on other platforms where you had some interaction. So it is going beyond the dental chair that you've made that connection with the person where they feel that, yes, I can invest my time and trust into you. So it is about being genuinely interested in the patients that you will understand that they can then trust you. Now, this is where, all the earlier questions about patients not accepting treatment and how do I get them to say yes to what I'm proposing comes up. When I went to the course about communication, which triggered my interest more further into the subject, I came across the book by Carl Denege.
Can you repeat that? The book by?
Sorry, let me get the name of the book correct for you.
Dale Carnegie.
Dale Carnegie. Yes, sorry. Dale Carnegie. It was about how to influence people and make friends.
Right. Absolutely. Thank you, Dr. Manish. We have Dr. Manish attending here with us, a celebrity in our midst. Thank you.
I didn't know that only females were invited. I've just barged in.
No. We have males also, doctor.
This is going fantastic. And I'm listening to this lecture for the third time, actually, and I'm getting more insights. So thank you, Shilpa. Thank you.
Thank you. Being genuinely interested in others rather than being interesting has been something which has struck with me, because often we are trying to impress others by showing this is all what I can do, this is how I do things. And in all that showcasing, we often forget to ask, what is the other person's interests? Now, this could be outside dentistry. how many times do we take a moment to ask what the other person is doing? Or how many times do we actually focus and remember what the other person spoke to us when we met last time? Apart from when it is something that is of our interest. Does it make sense?
Yeah, definitely. I think we already set in our minds what we want to say to our patients even before they come in, right? So a lot of times we don't really bother to spend the time to build that rapport. We expect it to just happen when they enter, sit for that root canal, and and that's it. We've done a great job at the root canal, but what about the relationship? What about the connection? The underlying message or the underlying mission that we have when we're performing the treatment is to seal or build that rapport while doing that treatment. So I think
True.
that's the signature of some of the most successful dentists, is what I've seen. That by the time the root canal is done, you feel like you've known the person for years.
Yes. And this comes when you show genuine interest. It initially, for the first few times, like for people who struggle to talk, people who are introverts
Yes.
and who are shy, do feel a little bit of an overwhelm when they're making that small talk, and it is very hard. But when we do the same thing over and over and over, we start recognizing our own skills.
Right.
And everyone likes to talk about themselves. They just need that platform, just need that chance.
Correct.
And if you give a point, or if you give a chance to the other person to talk about themselves, that is when they feel really good about themselves, but they feel that you were very good.
Correct.
So the focus changes, and that is what helps build up the rapport.
Great.
So for people who struggle to kind of have small talk, there are simple things that you could follow. Now, here in the UK, holidays and weather is a big icebreaker. So even if you don't know a person, you're stood behind next to someone, and you want to initiate a conversation, you just start talking about the weather.
Right.
Whereas in India, I'm sure we've all done it. You can start talking about family, or how's your day going to be, or what have you planned for rest of the day. Get them talking about something personal to them. If you don't know the person, then ask questions. We are often scared of asking questions. We are scared that, oh, am I getting too intrusive?
Correct.
But if we ask just the what questions, or we just ask something about leading questions, the patient feels happy to talk.
Right.
And that is what can establish the connection. And you're doing it genuinely. You're not doing it in an artificial way. Because that's when you connect human to human.
True. And
Yeah?
I think the person has to be more than just a mouth of teeth or like an implant case or a root canal case for us. The person has to be the person first, and then, the treatment after that.
Yeah.
So we have Dr. Joseph asking us about, how to convince patients for implant treatments. Maybe we can take that at the end of the session. Just give us a little bit of how you would do an implant consult. Maybe we can take that up right at the end of the session. So Dr. Joseph, you can actually probably see how Dr. Shilpa would talk to a patient when it comes to implants or any other treatment. Doctor, would that be okay?
Sure.
Yeah.
Sure.
And we have one more question, if I can interrupt you, is that Dr. Maria is asking, if we create a blunder with a patient, is it better to manipulate and make it right, or be honest with them, explain the blunder, and then try to make it better? How will it affect the trust of the patient? This is a good one because it really tests our communication and our rapport that we just built with the patient.
So before I set off, I explain to the patient the possible problems that we could lead to. Like if I'm doing an extraction, however simple an extraction is, I will always mention there is a possibility of fracture. There is a possibility that we'll need a surgical extraction. So if mid-treatment it happens, it is not that I'm trying to cover up for something which I have done wrong. It happens, but there's a solution to it.
Right.
Similarly, in root canal treatments as well, we assume that, oh yes, this is a very straightforward root canal and I'll get it done absolutely spot on. We speak about all the advantages. We always give them about the best scenarios. But just before I'm going to start the treatment, I do mention possibility of a failure, possibility of what might go wrong, but ways of how we can deal with it. So that
can come as a shock to the patient.
exactly.
Right.
And if I have done something which was unintentional, which is not as to plan, I will make a note. I will tell it to the patient.
Right.
Because if I don't inform the patient and then it goes further more wrong, I'm in a deep soup.
Right. So in our live, I remember you were talking about these uncomfortable conversations that we need to have sometimes, like an instrument is broken or something has gone wrong, completely out of what we were planning. I think that's exactly what here, it would be a very uncomfortable conversation to have, but you're saying it's important to have it.
Yeah, I mean, if you've already mentioned to the patient before the start of the treatment that it doesn't happen often, but it is one of the things that I want you to be aware of. And that's why I think here in UK, the evidence-based dentistry makes it much, much more effective because it is evidence-based that yes, instruments fracture. However, there is a way of dealing with it.
Right.
As long as there is a way of dealing with it and you are not going to get too stressed while doing it, patient is fine with it. But if I have not mentioned about the file breakage before I start with the treatment, I've given the patient a very rosy picture that, oh yes, this is straightforward and it's going to be brilliant. And then something happens. That's when patients feel a little bit stressed.
Right.
Yeah.
So I think this communication starts even before the treatment starts, where we are being
Absolutely.
honest and transparent with the patient. And I think it'll end in the way we, even our non-verbal cues, when we're actually dealing with the problem, are we giving out the wrong signals and panicking the patient? Or are we staying calm and, referring back to the conversation we already had, that this could have happened, it has happened, but don't worry, this is what we're going to do about it.
At the end of the day, if we can show that we are in control,
yes,
and we are calm, we are able to deal with whatever is there.
Right.
I think patients understand.
Completely.
And we assume that, oh my goodness, now I've done this blunder, because we judge ourselves quite harshly. And that's where all this fear stems from. So we all do mistakes, but as long as we are open about accepting, yes, I've done the mistake, and how can I rectify it, rather than getting confrontational and trying to shift the blame.
Yeah.
When there is a blame game starting, there is always a hero, there is always a victim.
Right.
And then no one's kind of going to win out of that situation.
Right.
Yeah.
So Dr. Maria, I hope that answered your question. Yes, you can go ahead, doctor.
So now the most important bit, which is the listening skills. So I say that husbands have an innate ability of selective listening, and we all have experienced it in different ways and forms, not just like in a marriage, but we ourselves, we listen and we remember things that we want to. And so active listening is what actually makes a communication win-win for everyone involved.
Right.
And active listening is the hardest. Our attention span is limited. To make it interesting, if there are like if these slides were completely just writing only, I would have lost probably 50% of your attention in the early stages itself. If I'm talking what you resonate with, you clue into the idea more better. If it is something that you don't really agree with, we just discount it and we are ready to move on. Especially in today's day and age where it's like a very quick flick of the social media, our attention span is decreasing even further. And so being invested in enabling our own strengths for listening, we have it. It is just about honing them. And for that, it is absolutely little things of being aware that when I'm listening to someone, I'm having a conversation with myself up here, and then I'm interpreting it. So my bias is kicking in, which often means that though I think I'm listening, I'm not actually actively listening. I'm listening to interpret, I'm listening to reply, or I'm listening to contradict. So again, it is about the ability to be able to keep us focused on what is being said. If you want to probably maintain more proper listening, ask questions. The more we ask questions, the more we listen, the more we actually retain. And when we are talking to our patients or when we are talking to our team, summarizing helps. So when a patient is coming to you with a complaint and we've made a note of everything and we've asked lots of questions of what and how they have encountered it, and then we've summarized it back to them, patients feel that, yes, you have taken the time to listen to me. Like the other day, Diksha, you were saying about patients who come in and who say, बस आपसे बात करके ही मेरा दर्द कम हो गया.
Right, absolutely.
And for those patients, it is where you have actually taken time to listen to them, that they feel that they are more at ease. Also, the question should be more of what than why, because why often triggers confrontation. Why can be interpreted in a very challenging sort of a way. So again, how am I listening? Am I listening to just reply back, or am I listening to make an interpretation? And then are we on the same page? Again, when I have interpreted something, my own conditioning, my own past biases what I am kind of interpreting a particular situation. So when we actively listen, it is not just the words that we are listening for. We are listening for how the patient is saying those things. So it's the feelings that we are listening for. So a particular emotion can affect the same statement in lots of different ways. But what is it that the patient actually means? We find it out by summarizing it.
Right.
And once we summarize, we can ask patients, is this what you meant? So we are giving them one more chance of saying that, yes, I have understood you correctly, or is there something that I have missed?
Correct.
Yeah.
You're reaffirming what they just said. I think this is a very good practice because since I've started doing that, you can actually confirm that you and the patient are on the same page. Otherwise, a lot is lost in communication until you do that last step.
it is an exercise that we all could do. Just sitting down 5 minutes with your team member and just getting them to talk. Yeah, just talk randomly. You are asking them 10 questions, just one after the other. And then you spend another 5 minutes actually asking questions linked to what they've said. And you find out what works best. Often we dentists have a page of questions that we are going to ask a patient who comes in for, say, a root canal treatment or a crown treatment or a implant consult. We have got it in our head. This is all what I need to tell, or this is all what I need to ask them. Often it is about what I need to tell rather than what I need to ask.
Correct.
And when we are telling, as I said, listening, not just ours, anyone else's, if it is not of interest to them, they've shut down. So a patient who has walked into the surgery, who's come in with probably the thought that, yes, this is the tooth that I want it to be taken out. I don't want anything else. And we have started telling them pros and cons about a root canal treatment. They've already made a decision. This is not what I want.
Right.
And then we think, oh, I spent so much of time on a consultation with that patient and they didn't agree with the treatment.
Correct.
But I haven't taken time to ask them, okay, this is a situation. What is it that you expect? I'm not saying that we are saying yes to giving that particular treatment, but till we have explored their assumptions, their interpretation of what their situation is, they've already got probably an extraction in mind, but there's a reason why they've thought of extraction. If we've not gone down to that, we've not checked out what holds them back, there is a very less chance that they will agree with whatever we say or we think will be best for them.
Correct. Sorry, I have to relate one of my experiences here that before I did the DBM program, my consult used to look like this, where I would be talking throughout, and I thought I was an excellent orator and communicator to my patients. My patient loves me, they gets convinced for all the treatments. But it used to be where I'm talking for maybe 5 minutes of the consult, and the patient talks to me for about 1 minute when they come in. After that, when I learned from Dr. Manish what should the ratio be, it's probably 80% where the patient is talking and you're listening, and 20% when you offer the solutions. So that really changed the way patients started converting, because suddenly they felt heard. I was giving them probably the same solutions or the same treatment plan that I would have otherwise, but I was far more crisp in my communication, and I was spending a lot of time listening, which was a real challenge in the beginning. But I think that's what changes everything. When you listen to somebody, it means the world.
It is remembering how you feel when someone gives you the time to listen to what you're saying.
Correct.
So, and then is the most important part,
Yes.
which is the support or the team. Support of a teamwork is what makes any communication better. So it starts right from the reception to the treatment coordinator to my nurse getting the patient in, and then last is me talking to the patient about the treatments. Now this is in terms of a support work for a patient, but this can also work around your team. When the team feels supported, when they feel heard, that's when there is a good rapport, there's a good teamwork, and any kind of uncomfortable conversations can be actually had with empathy, because there is understanding of each other's perspectives. Does this make sense?
Absolutely. In fact, Dr. Sana just asked us a question a few questions back, was that is there anything we can do to communicate better with our teams? And is there something that can help, um, actually motivate them? So how do we actually support our teams?
So this is what I do as a part of my coaching mentoring, where I use profiling tools where we identify the strengths of our team members, and that's how we can encourage and we can build upon it. Now, every individual has their own strengths, has got their different motivating factors, and has got their own fears or stress factors.
Right.
When we are able to identify these, that's when we can actually communicate more effectively with each other. So you can't motivate a person unless you know what motivates them. You can't motivate a person or you can't get a team member to do a certain thing unless we understand what's stopping them. And we assume, again, assumption plays a big role in stopping us being able to have an effective teamwork, effective communication, effective conflict resolution as well. So it is about understanding what is it that they want at the end of the day. Yeah. So every person has their own strengths, but often we focus on weaknesses and we want to improve the weaknesses.
Right.
So the strengths, which could be actually the confidence booster, get overlooked because wo to hai hi. It is definitely there. We sort of take it for granted.
True.
And I have learned this a big way because we always used to do SWOT analysis. We have CPD cycles which are monitored every year, and we have to create our own professional development plan. Now, to create that PDP or professional development plan, we used to do a SWOT analysis, and it was a simple checkbox exercise where you enumerate your strengths, your weaknesses, and that's how you identify what opportunities you would have and look at the threats. So you just kind of work focused completely on your weaknesses because you want to get your weaknesses better, like you want to work on them to get better. However, when we started doing it in a slightly different way, yes, weaknesses are opportunities. So you change the way you're looking at it. So rather than it being an obstacle, it becomes an opportunity, and just changing that word affects the way you interpret it. Your strengths are your strengths, but how would you hone them? Once you focus on those strengths, actually, you are building up on the confidence. And if you do have a weakness which you consider as a threat, there would be a team member who actually has the similar thing, but which is their strength.
Right.
So then it almost becomes a jigsaw puzzle which matches up perfectly to create a good picture.
Okay. That's effective teamwork right there.
Yes.
If they can complement each other's strengths and weaknesses.
So rather than getting bogged down by our own weaknesses and pointing out weaknesses in others, look at what strengths we have together.
Right.
And then match it up. And that is what often will give a very simple, easy flow, not just in the practice, even non-clinically. It takes away a lot of pressure.
Absolutely.
Yeah. So sometimes when we identify that, yes, this is a particular weakness, we want them to do it better immediately. But then we forget if it is my weakness, how would I handle it? I would probably just want to deal with it, or I might get bogged down by it and I don't want to face it.
Right.
So, probably having a very simple step or plan of action where it's achievable. You set goals which are manageable. And when I set myself a goal which is manageable, that gives me the enthusiasm to do more. And that is how I can train myself to do anything which is out of my comfort zone. Yeah.
Lovely.
So, implementing again systems in practice, where Diksha, I'm sure your program talks really wonderfully about it. Creating the kind of different policies and systems, training them, and following up the training. We can't expect that, okay, once you've been shown, you have to be pro at it. You're allowed to fail. You're allowed to not do things perfectly, because that's how you're going to learn. And the more you give the opportunity to learn, that's how the team is going to grow. And then they're going to be able to actually train the other people joining the team more effectively.
Absolutely.
Yeah.
Agreed. And in fact, I would like to mention to everybody here who is struggling with team training, or getting your teams to work effectively. Next Sunday, we will be doing a program with Dr. Manish Chitnis on exactly at 11 o'clock next Sunday, where we will talk about all of these concepts that Dr. Shilpa has just explained in terms of communication, creating rapport, creating a SWOT analysis for your teams. A little homework is always required for your teams, and that's when the training begins, and that's when things really start to come together as a good patient experience. So we'll be doing this next Sunday at 11 o'clock. A lot of you here may not know that we do have a program on dental team training. And like we see, the pearls of communication, the S is the most important part, where your support staff, your team needs to be on the same page as you. So that's a training program for them. Yes, doctor, you can continue.
So the support for a great teamwork is extremely essential. But as much as a teamwork is essential, and as much as support for them is essential, now it is also about looking inwards.
Yes.
We feel that I know it all and I'm supposed to know it all. And as a good leader, I have to be able to lead all the time. But there are times when we need help ourselves, and we are reluctant to actually ask for help. And these could be, again, due to a lot of limiting beliefs. It could be a lot of inhibitions that we have. It could be due to certain fears that we have. But it is important to realize that there are people out there who are actually happy to help, because that is what drives them. Like as a dentist, getting a patient out of pain or giving a patient a beautiful smile is what drives a dentist. There are people around who actually feel fulfilled when they are able to help others.
Right.
And asking for help is a big thing. Don't make it an ego issue. Don't make it an issue where you feel failed and that's why you have to ask.
Right.
Even before we go down the dumps, if we are able to ask for that helping hand, it makes it much more better. And now this is about communication with yourself. If you're not communicating with yourself effectively in a positive way, you're not going to be able to effectively and positively communicate with anyone outside. So all these pearls, if you don't implement it just for yourself first, you're not going to be able to have that happy or a fulfilled communication, a win-win communication with others.
Absolutely. So, in fact, you mentioned, doctor, that you are a mindset coach and that it makes you happy to see dentists perform to their best ability by leveraging their personalities and communication. So, give us a little brief on what kind of work you do when you talk about mindset coaching, or what's a one-on-one session with you like?
So, again, going back to how it started for me, because to be very honest, I did not like to ask for help. And that was my biggest challenge. And when I identified that actually, no, if I ask for help, I'm making things easier for me.
Right.
I realized that there are so many other colleagues around me who were struggling for the same.
Exactly.
And that is what set me about this journey of coaching mentoring. And I use certain tools which I mentioned, like profiling, but it basically gives an ability to be able to almost be a sounding board. So where I said about listening, how many times do we feel that we are listened to? And often we put pressure on ourselves, and that is what stops us. So, because I found that this is what helps or has helped quite a lot of people come out of their shell and be able to actually work outside their comfort zone, that is what motivates me to try and help more dentists like me around, just to be able to be happy and comfortable in whatever we do, clinical or non-clinical. Everything hasn't got to be just about dentistry. Dentistry is one aspect of our life. There are lots of other multiple facets around it. And if we are happy in one, we can kind of radiate that happiness all around. So yes, thank you. On that note, if there are any more further questions, I'll be happy to take them.
Yes, there are two questions and there are some good reviews coming in already. Dr. Pragya Roy is saying thank you for a wonderful session. And even Dr. Sana's question was answered well, and she really liked the point of highlighting and working on strength and working better to better our weaknesses. There is a question by Dr. Sanhita, which is a very common question, especially in India today. What happens is that we get a lot of phone calls where patients are window shopping, asking us rates, and that's really the beginning and the end of the conversation. They want to know the price of a treatment, and if your price doesn't sort of satisfy their expectations, that's the end of the conversation. So especially as a young dentist or someone who's just started their practice, how do you tackle these phone calls? And how do you communicate such that the conversation doesn't end there, but you can keep stretching it, getting the patient actually into the clinic?
So it is almost similar situation for us here at times. Like patients are shopping for NHS spaces.
Wow, that's good to know that it's in other parts of the world as well.
It's people are same. Go anywhere in the world. It's just the way they do things is slightly different. But the end of it all, they think similarly.
Right.
So we are hesitant to talk about our prices. Yes. Because we think that if I give out the price, the patient will not come to the practice.
Correct.
However, it is a good way of looking at it that if it is a person who is just window shopping or is just looking out for prices, anyways, he's made up his mind whether he's going to come or not.
Right.
So whether you tell them the fees, it's not going to make any difference. It is about building up the value. What is it that you can do for them?
Correct.
And so the way we do it is we firstly ask them, are they in any pain? Is there something that we can help them with?
Right.
And then if it is about pain, then we go further into, yes, we can definitely help you. And this is what we do. So it is almost like having a virtual consult. Now,
here what happens, doctor, is a lot of them have already spoken to 3-4 practices before you, so they're really not listening to what you have to offer. They just want to get the price, and this happens a lot where they're adamant on like, no, but tell me the price, no, but tell me the price, only then I'll come in.
Yeah, so you tell them the price. It is not about not telling the price, but along with it, ask them questions.
Yeah.
Because they are asking you questions, but they have made up they are listening with a bias.
Correct.
So it is about time to change the way we shift it. Again, get them to talk more. Get them to talk more about their problem.
True.
And often, if they've spent a little bit longer time, they feel the connection, they'll be able to at least come and explore. If it's not in their budget, it's not in their budget. You can't do much.
Right.
Unless you want to drop the prices on, unless you want to give them a range. And if that range kind of is in their what they were ready for, they'll
Right.
come.
Correct.
Does that make sense? I mean,
So what we do see is that as a principle, should we reveal our charges or not reveal our charges? That's the critical question here.
if you feel confident about your charges, yes, why not? Because when the patient walks into the practice, you are going to tell them the charges. So rather than it being a kind of a let down at that stage, if the patient already knows what they're coming in for, they're prepared for it.
Correct. Right. So, Dr. Sanita, what we would like to say here is that probably it's better off that you don't have a window shopper showing up and wasting your clinical time. It's better you tackle them on the phone itself. But what doctor is suggesting is that maybe if you ask them more questions and draw them into the conversation, then maybe the end result will be something a bit more productive. And you are also in control of that conversation instead of the patient just asking you a price and hanging up the phone. So what I also do in my practice is try and convince them at least for a virtual consultation, even if it's free, just for them to see the practice, for them to get about 10 minutes with us to understand what we do differently. And that might help them change their mind. And even if we are more expensive than the next door dentist, they can still try and opt for that if they did feel like, that's if they were impressed by those 5-10 minutes with us.
True.
Right. So that's lovely. And Doc, there's one question from Dr. Joseph, which was about the implant consults. I think everyone here is always is always trying. All of us, of course, are trying to convince our patients for expensive treatments and want to learn how to do that.
So, as I mentioned earlier, it is about firstly what the patient expects, and then giving the patient all the options. However, in this, like you said, Diksha, earlier about the consult being 80% the patient talking and 20% you talking, the more you talk to the patient and he or she tells you what they are expecting,
Right.
then you kind of are just giving them what they want.
Correct.
And it is a quite detailed process about how you explain or how you talk to them about the outcomes, or how it is more about what they're going to get as a result of the treatment, not the actual technical stuff.
Right.
So yeah, it is about, are you selling an implant or are you getting them a tooth which will help them eat properly?
Correct.
It is how you speak to them. It is the same thing. But what is it that the patient is looking for? Is he looking for an implant, or implant is just a solution?
Got it.
Yeah.
So I think that itself is the key to convincing patients for bigger treatments or things that we consider bigger treatments. For the patient, it might just be another day at the dentist, where we start talking to them about the benefits of the treatment more than the name or the technicality of the treatment. What I also see a lot of times is that I know when I've lost the patient and he's not listening to me, his eyes are glazing over. When I go into, oh, I'm going to place immediate implants with active surface, with this, that, the minute I go into showing off about the technical details, you see, you lost the patient there. It's not about not being able to convince them for dental implants. It's about what it translates for them. If we
Yeah.
can tell them that the value is that today you're not going to be wearing a denture and you're going to be walking around confidently, no one will ever know that this is a artificial tooth, it'll last you for kingdom come for really long, then they start listening because it's all in their interest, and that's when they want to pay for something like that.
Yeah. So usually cost or treatment, treatment finance is never the objection.
Correct.
There's everything around it. Could be
The
that the
value
patient
we
is
build.
scared. Could be
Right.
that the patient is nervous. Could be that the patient is not able to actually make up the mind. There is
True.
someone else who's a decision maker.
True.
And also simple treatments like a good composite filling.
Yes.
I am trying to show them how good it looks aesthetically. But if for the patient, aesthetics, they don't understand,
Yeah.
if they just understand a replacement of a cavity, it is how I translate to their expectations.
Correct. Speak in their language if we've actively listened.
Yeah.
Lovely. So I think I'm hoping that everyone who's stuck around has actively listened to this session. We would love to hear you in the comments as to how you found this session. I would really encourage all of you to book your one-on-one session with Dr. Shilpa. So you really understand the depth of what she does for dentists. And for all of you who are not yet part of our Widen group, please ensure that you are. We are posting the link in the comments here. And with that, Doctor, we'd love to get some last words from you, some good words of advice for everyone who attended today on communication.
Communication is just a way of connection. Don't get too hung up by your own biases or assumptions, because often when we assume, we make ass of you and me. So on that note, I hope this has been informative. Absolutely. And I look forward to connecting with few of you.
Thank you so much. And we've, in fact, crossed our timeline. Usually this has probably been the longest session because it's been so interesting and there have been so many questions. I do hope we've done justice to all the questions that were asked. If anybody needs to ask any more, please make sure that you're posting in our Widen group. And thank you so much. I'll just read out some of the comments. Dr. Sana says, was a really informative session. Thank you, Dr. Shilpa, Dr. Diksha. Dr. Sanita says it was a wonderful session and with good solutions. So I think all in all, we have a lot of people who spent time with us this Sunday. And thank you so much, Dr. Shilpa, for making this session so informative and so interactive.
Thank you very much. Thank you.
Enjoyed this time that you've given us, and have a great weekend. Thank you so much.
Thank you.
Thank you, everyone. And we continue to stay connected on all our social media platforms. Thank you so much for attending today. And as you go back home today, please make sure that you apply this pearls of communication not only to you and your patient, but also to you and your team. I think that really will be the kicker. And I look forward to seeing most of you next Sunday. If you're interested in our team training program, 11 o'clock, do register for the same as well. Thank you and take care.
Thank you. Bye.
Thank you. Bye-bye.